Well, hello everybody, and welcome to this latest edition of the Maltcast, the series of video and audio podcasts that I'm doing during this awful COVID crisis from across the constituency, talking to individuals and groups who are involved in the effort to deal with this, to bring us all through it, hopefully safely. And I'm very pleased to welcome today Alex Whitfield, who's the Chief Executive of Hampshire Hospitals, who's one of the individuals who's obviously in the eye of the storm, in that she runs both the hospital in Basingstoke, Winchester, and of course the Andover War Memorial Hospital, which I'm hoping we could talk about a little bit later. She's been in post now for 3 years, she tells me, amazingly. I still think of her as new, but obviously this is an enormous challenge that she's had to face, probably one of the biggest challenges that anybody in her position would have to face. So we're very pleased to talk to her this afternoon. Alex, very nice to see you. Thanks very much for joining us. I'm sure you're flat out busy, so we'll try and rattle through things as quickly as we can. I guess the big question that will be in everybody's mind is, how are you getting on with the crisis at the moment?
Yes, thank you, Kit. It's really nice to talk to you. Yes, well, we're coping at the moment. So I think some of the predictions we saw about numbers, luckily the social distancing and lockdown measures have had an impact, and we haven't seen the high levels of numbers that we were fearing. And so we are managing. We have 105 positive patients in our hospitals today, split across Basingstoke and Winchester. Andover War Memorial, we've managed to keep COVID free, which is very good. The pressure is really on the ventilated capacity, where we've got 19 patients today across Basingstoke and Winchester intensive care units who are being ventilated, and that's where the pressure is being seen. But yes, no, the public have been really helpful, and we are not seeing the same pressures that we thought we might.
Okay, and so in both of the hospitals then, in Winchester and Basingstoke, you still have capacity if there were a peak to come, say?
Yes, so yes, indeed. So we still have some capacity for COVID patients, and the other bit we're really keen to get the message across is we've still got capacity for people who haven't got COVID as well, because we've seen a real reduction in the number of patients coming to hospital with the normal things that we would see, the sort of heart attacks and strokes and that kind of thing. So, but we are very able to look after those people in COVID-free areas and look after them well as look after the COVID patients.
Yes, we had on one of our update calls, I think it was a week or so ago, you did say that you were a bit concerned that the non-COVID bits of the hospital were very quiet. That might have an impact on people's health. I mean, if people do have a reason that they think in normal times they would come to hospital, what is your advice to them? I mean, a lot of people will be nervous about coming to hospital naturally because of this awful disease, but should they just come? Should they talk to their GP first? What do you want them to do?
Yes, absolutely. They should behave as they normally would. So talk to their GP if that's what they would normally do, and the GP can then either look after them directly, and GPs are running some what they're calling hot hubs where people who've got COVID symptoms can go, but also cold sites where they can see people who haven't got COVID symptoms. And if they've got chest pain or symptoms of a stroke or something like that, then they need to come straight to hospital, dial 999 if they need an ambulance, come straight to hospital. And then once they get to Basingstoke or Winchester, we have it looks a bit like a sort of ticket booth kind of thing right outside the front of the emergency departments, where they'll be asked, have you got a temperature, have you got a cough? If they have symptoms of COVID, they go into one half of the department, and if they don't, they go to a completely separate other half of the department. So separate staffing teams, separate stores areas, separate everything. So we're very capable of looking after people whether or not they've got COVID symptoms.
Okay, good. Well, I know people will be reassured to know you're in great shape. One area, though, that obviously has been of concern across the country has been about the safety of your staff, and in particular this issue of PPE, of protective equipment. How is that going for you, and what's the kind of protective equipment situation?
So the first thing I want to say is I want to assure everybody that we have never sent a clinician in to look after a patient without the right PPE. So Public Health England put out guidance about the protective equipment that's needed, and we have always had enough stock to make sure that every single clinician has got the right kit to look after the patient in line with the guidance. So while there have been some anxieties in the background about stocks getting a bit low and deliveries arriving just in time in order to make sure that we continue to protect our frontline staff, we've never got to the stage of running out. So we've had various different kind of peaks and troughs for different types of PPE, and the last couple of weeks has been about these fluid resistant gowns and making sure we've had enough of them available. but through the national supply chain, as well as our local private hospitals have managed to find some for us, and various other places, we've always had enough for our frontline staff.
Okay, well that's good to know, because obviously we've all been out there on a Thursday night applauding away for all of them who are doing a fantastic job, but knowing that they're getting the PPE that they need. I mean, certainly I know in the other part of my job, the policing job, that the police have a good and robust supply chain now around PPE. So hopefully that will calm down. Now, obviously, the only hospital for the moment that's in my constituency is the Andover War Memorial Hospital, which you'll know is very close to the heart of people in and around that part of Tess Valley. Yeah. How has COVID impacted that hospital, and what's sort of happening there at the moment?
So Andover War Memorial is very close to my heart as well. I love going to visit our staff there and talk to them, and they have been amazing through this period. So as I say, we've kept that free of COVID, and what we've been able to do is move quite a lot of services to Andover for patients who don't have COVID. So we've moved a lot of our antenatal appointments for pregnant women to Andover, so they can go in and have the checks for babies' heartbeats and the routine appointments that they need in a hospital where there isn't any COVID. And both staff who are having to travel to Andover, who would normally be in Basingstoke or Winchester, and patients are loving it. They love going to Andover War Memorial. It's easy to park, it's very convenient, the staff are ever so friendly. So we've moved that out there. We're doing quite a lot of urology, small operating procedures in the day surgery unit there, and that's going very well. And I don't know if you're aware, but the new hospice building, which was the big talk of the Andover War Memorial, we actually moved our first patients in there a week or so ago. Okay, so that's open as well. Yes.
Well, that's great news. I know there was meant to be a sort of ribbon cutting or whatever to open that building. Hopefully, we'll do that in the future. It's a great new extension.
Yeah. The one thing I would say.
Yeah, go on.
Yeah, where the one thing that I think is a real shame, but it's not forever, is we have had to close the minor injury unit in Andover, and we're absolutely committed to getting it reopened as soon as we can. And there were two drivers for that. So firstly, actually, the people of Andover had stopped using it. So we had a Sunday where there were only 4 people who came in, and I think with the lockdown, people were sort of saying, unless I really need an emergency department, I'm not going to come to a hospital. So we weren't seeing very many patients accessing it, and the staff in there are really highly skilled nurses who, you know, it's a nurse run service, so they've got a lot of independent skills, and we really needed them in the intensive care units and the emergency departments in the main hospitals in Basingstoke and Winchester. So we've managed to pull those staff into some of the other core functions, but it is only temporary, I do want to assure people.
Yes, well, you obviously notified me at the time, and given your reasoning, I don't think there's anybody of a reasonable mind who would object to that. I mean, obviously, one of the strange effects of this COVID crisis is because people are on lockdown, they're not injuring themselves in the same way that they were before. They're not falling off ladders or being in minor car crashes or all of those things, which is, I guess, a plus, although one we'd rather be without, if you see what I mean.
When I talked to the minor injury nurses while we were still open and the numbers were very low, and I said to them what did they think was happening, and they said, well, quite a lot of their attendances are usually from school PE classes, so children or football, you know, children's football matches on a Sunday, or so actually without those happening, that was reducing the footfall.
It's changed the workload. Okay, well, that's good to know. It's good to know that when we get back to normal, it'll come back. It's just a temporary thing. And as you say, the staff there are so fantastic and well loved, that it's good to know they're being used in the front line of this crisis too. Now, final thing I was supposed to ask is, where do we go for the future? Obviously, you had plans, I think they were in the local paper, to open a temporary sort of Nightingale hospital in a hotel near Basingstoke, but the numbers, as I understand them, aren't what you were expecting or what you were led to expect. Where do you think this is going next?
Yes, so what we're trying to do now is, in terms of understanding the modelling about how many patients we should expect to have, and you will have heard that there was original expectation was about a peak, which was a kind of, you know, Mount Everest, very sharp peak of numbers, and we're now in a position where we think there's actually going to be a long plateau of numbers. So the sort of 100-odd patients that we've got in our hospitals today, we probably need to plan to expect that we will have that for several weeks or months to come. So what we're now looking at is, how do we restart some of the planned work that we stood down in expectation of a real peak, but at the same time ensure that we can keep those patients safe and that we've got sufficient capacity should the numbers start to increase again, because as different lockdown methods, things are lifted, we may see an increase again. So we need to work out the waves, how much capacity we've got. We think through all of that, the plans around a kind of Nightingale-style hospital in North Hampshire aren't required on the current modelling, so those plans have stopped. We've got them on the shelf should we need to pull them off again, but we're not anticipating needing to do that. And then we're also working with our local partners in the commissioners and Hampshire County Council, and they've been looking at hotel accommodation, which is more for people who would normally have some domiciliary carers coming in, people coming into people's houses to sort of get them up in the mornings and things like that. If we had a lot of people who had been through COVID and needed ongoing support, then we may end up using hotels for that. But from a hospital perspective, we think we've got the capacity in the hospitals.
Okay, well, that's, as I said earlier, that's very reassuring to know. I mean, obviously, certainly in my constituency, we've had very, very good observance of social distancing. Yes. So fingers crossed, the numbers, certainly in my bit of Hampshire, continue to be as good as they have been in the past. Notwithstanding, I think as we get towards the end of the 3 weeks, this further 3 weeks, people are getting more and more frustrated. And you know, one of the issues from a health point of view we'll have to think about is people's mental health and well-being after a long period of isolation. I mean, certainly my kids, you can tell, are feeling it already. But if we were living on our own, you know, with possibly other mental health issues, you could see how things might deteriorate. And I'm very pleased that you think there's going to be capacity for some of that other urgent but elective sort of surgery that might be required to save people's lives as well. I know they're nationally thinking about that too. Listen, it's been fantastic to talk to you. Thank you very much indeed. Will you please give our best wishes and thanks to all your staff? They're doing a fantastic job.
Yeah.
You know, we do obviously all appreciate it. I know it's been difficult for you, and I know that sadly we've had some patients who've died during this crisis. But nevertheless, you're all doing a fantastic job, and it's great to see. I, as I said earlier, I was out last night, albeit we live outside of earshot of anybody else, but clapping away, and I could literally hear the cheering from the village a mile away.
It's been amazing. The public support for the NHS has just been incredible. The clapping, but also we've had so many gifts, people bringing in chocolates and Easter eggs, and it's just been lovely. And and thank you. I will pass your thanks on to the amazing people I have the privilege to work with. It's incredible.
Yeah, no, it's great. I know that George and Dragon in Hurstbourne-Tarrant have been ringing into Andover War Memorial Hospital every Sunday to ask them what they want to eat and then bringing them food.
It's wonderful.
Which is great. Anyway, look, I'll let you get back. Thanks very much indeed. No doubt we'll stay in touch, but good luck and thank you very much. And we'll put this out on Facebook, Twitter, Instagram, the works, besides everything you're doing. Thanks a lot. Bye.
Thank you, Kurt. Stay safe.